Hello and welcome to the Encephalitis Podcast. My name is Prav and I'm from Encephalitis International. Today, as part of our campaign for World Immunization Week, we will be talking about the importance of completing one's vaccinations to ensure full protection from encephalitis. To learn more, I'm grateful to be speaking to Professor Lance Turtle. Professor Lance Turtle, PhD, FRCP, DTMH, is Chair in Immunity and Infectious Diseases, Honorary Consultant Physician in Infectious Diseases, and Deputy Head of Department of Clinical Infection, Microbiology, and Immunology at the University of Liverpool. His current research interests include pathogenesis of arboviral disease, neurological infections, immunity to infection, and immune cross-reactivity between flaviviruses. His work has been funded by the Wellcome Trust, the National Institute for Health and Care Research, EU Horizon 2020, and the UK Department of Health, Innovate UK. Professor Turtle, welcome to the Encephalitis Podcast. How are you doing?
Thanks very much. I'm doing well. How are you?
Yeah, I'm doing well, thank you.
Good.
So to start off, the World Health Organization has called vaccine hesitancy one of the top 10 threats to global health. Could you explain to us how vaccines protect people from getting encephalitis?
Yeah, so vaccines prevent you get from getting encephalitis specifically in a few different ways. So there are some organisms, bugs out there that can directly cause encephalitis. And a vaccine can prevent that just by giving immunity to that organism. So an example of that would be Japanese encephalitis, which is a vector-borne and mosquito-borne infection, or tick-borne encephalitis, which is a similar disease spread by ticks. Another example would be rabies, which is a form of encephalitis. So those are the kind of the sort of most direct ways of a vaccine preventing encephalitis. Then there are other infections which can occasionally get into the brain. That's not a typical outcome of infection, or they can make the brain inflamed, or there's some other kind of problem that goes along with the infection that affects the brain. And that means that if you're vaccinated, then you're less likely to get that brain complication, even though that's not the most common illness. So there are lots of examples of those. Influenza, for example, can occasionally get in the brain. Most people will just get a respiratory illness, but if you're vaccinated, you won't get encephalitis with influenza. Dengue fever is another one. There's a vaccine against dengue fever now. In some countries, the uses of that are slightly restricted, but that can also get into the brain. Chikungunya, that's another virus that, like dengue, is spread by mosquitoes. And then there are some bacteria that can either cause inflammation of the brain, or more commonly inflammation of the layers around the brain, the meninges, which also can end up causing damage to the brain, like group B meningitis has been in the news in the UK recently. That is a vaccine against that. The pneumococcus, which is the pneumonia bacteria, can also affect the brain. And there's a bacteria called Haemophilus influenzae type B. So there are several other vaccines that can prevent brain complications. And you see quite a lot of brain complications, things like strokes and other problems in patients with COVID as well. So COVID vaccines can prevent that as an indirect mechanism. And also the shingles vaccine, actually, you can get the chickenpox virus can affect the brain. So in theory, chickenpox vaccination could prevent that, although those vaccines have not been around that long, and the evidence for that is not so convincing yet. But that's very likely to be the case. So lots of different ways in which vaccines can help prevent encephalitis. They can't prevent all encephalitis. Some of which is autoimmune, for example, and can actually be caused by a vaccine, sometimes, rarely, but they can certainly reduce the burden of infectious encephalitis.
Lovely. Many people assume that a single vaccine dose ensures enough protection. Could you talk us through the immunological reasons why it's important to complete the full schedule?
Yeah, so the reason that a single dose doesn't give you full protection is that when you give somebody a vaccine, you're giving a very weakened form of the infection. So you're either giving something which is just a piece of protein or a killed piece of the microorganism that causes the disease, or you're giving a very attenuated version, because obviously you don't want to risk the complications of the disease. And what that means is that to get a good enough immune response, you really need multiple doses of the vaccine, usually. Not always. There are some vaccines which are single dose, and they work very well. Like yellow fever is an example of a single dose vaccine, which works very well. But the majority of vaccines need more than one dose. So flu vaccines, I mean, we only have one dose of flu vaccine every year, but we have it every year. So we end up having lots of doses, and we're all exposed to flu anyway. So we build up immunity over our lifetime. We all know that COVID vaccines needed multiple doses really to be effective, especially against different variants of the virus. Vaccines like Japanese encephalitis and tick-borne encephalitis and rabies, they all need more than one dose, often two or sometimes even three doses to be really effective. I mean, one dose is probably better than nothing, but it's nothing like as good as having the full course, which will give you much higher antibody levels, much better immune response, and much better protection. Not only better protection, but also protection that lasts longer.
You have touched on this, but what do the data tell us about protection levels after partial versus full vaccination?
Well, that varies by vaccine. Quite often we don't know in detail in terms of clinical protection, such as the number of people who will get sick, but we do know that antibody levels are much lower. I mean, they're much lower in lots of examples. I mean, Japanese encephalitis, for example, the antibodies are really almost undetectable if you only have one dose of vaccine. Whereas if you have two doses, they can be very high. So that booster dose, that second dose is really important.
Evidence from healthcare partners and recent academic studies shows concerning drop-off rates between first, second, third, and booster doses of many routine vaccines. Why do you believe people stop after that first dose?
Well, I think probably people think they are protected, or there is a perception the disease is not that serious, which in many cases is not inaccurate. I mean, lots of people have had flu and COVID, and yes, they've been sick for a few days and they recover. So, that perception is sometimes not entirely unreasonable. And sometimes people haven't seen these diseases and they don't know how bad they are because of vaccination and because of kind of, herd immunity. Enough other people around them are vaccinated that they're actually not seeing any cases of the disease. And so they don't know how bad it is. And I think a lot of lack of vaccination is really also just because of the attrition of attention of people and because of inconvenience, actually. And I can remember, getting flu vaccines in the NHS, and over time, people have changed how they deliver those. And actually, it's much easier now. People come round with a box of vaccine, and you can literally be seeing a patient, and they'll roll up your sleeve and stick a vaccine in your arm while you're working, which just makes life much, much easier. So some of it is really around accessibility. And I think that's a big reason why people don't get vaccinated. It's about taking the time to go somewhere and get the vaccine. And health systems can help with that by making it as accessible as possible. We saw with COVID, for example, when it's really serious and people are scared of the illness, vaccination rates are actually extremely high. Vaccination rates for COVID were very high in the UK in the kind of early spring of 2021. So I think it's a lot of it is around perception and access.
What does herd immunity mean?
Herd immunity means a herd immunity threshold is the point at which enough people in a population are immune to an infection to prevent transmission of the organism. So that's what herd immunity means. That requires a couple of things. It requires enough people to be immune, but it also requires them to have a particular type of immunity, which we call sterilizing immunity, which means that not only do you not get sick, but you actually don't get the infection. So there are quite a lot of vaccines that will not actually prevent infection, but will prevent disease. So polio vaccine, for example, you can still catch polio virus and it will still replicate in your gut, but it won't get into your brain and cause disease if you're immunized. If you have flu or SARS-CoV-2 vaccine, that reduces your chance of being infected, but not completely. And it reduces the severity of infection, but you may still become infected. So what you need for herd immunity is you need a vaccine that gives you sterilizing immunity so you cannot even acquire the infection. Remember that a vaccine is really meant to prevent disease. It's not meant to prevent infection, actually.
Thank you. For some types of encephalitis, herd immunity is not possible because humans are dead-end hosts for viral transmission. Could you describe the importance of the individual's need to complete the vaccination in these cases?
Yeah, so you're referring to there some of the arboviruses. So these are viruses transmitted from insects like mosquitoes and ticks. So like Japanese encephalitis and tick-borne encephalitis would be examples of these. So these are what we call a zoonosis. So a zoonosis is an illness you catch from animals and not from humans. And so that means you can vaccinate humans all you want. The illness isn't in the humans, it's in the animals. So it doesn't make any difference to transmission. The virus is still out there being transmitted. So in the case of Japanese encephalitis, which is probably globally the most important one, that's being spread between birds and mosquitoes. So you're never going to vaccinate every bird in Asia. It's clearly not realistic. So that means the virus is always going to be out there and is always going to be a threat to humans. So the only way to prevent human disease is to vaccinate all the humans. And that means that even people who haven't had, have missed a dose or something, even if everyone around them is vaccinated, that really makes no difference, actually. The mosquitoes have still got the virus in it, and those people are still at risk. And the only way for them to be protected is to be fully vaccinated.
Thank you. Earlier on, you did mention side effects, and I was wondering, how did the risks of not completing a vaccination compare to the risks of side effects?
Well, that depends on the disease and on where you are and on what the kind of frequency of infection is. So a disease like Japanese encephalitis, if you're living in an endemic area, then your risk is quite significant. Whereas if you're a traveller to an endemic area for a short period, say a few weeks, your risk is less. So that comes into the balance between risk of illness versus risk of side effects. But still, the side effects of vaccines like Japanese encephalitis and tick-borne encephalitis are actually very, very low. So the sort of balance of safety is still in favour of vaccination. I think in reality, what's a much bigger issue for people is cost with vaccines like that, because those are vaccines that are optional and they're given for people who travel in this situation, and so people are paying for it, unlike you being in a population where the immunization program delivered by the government is giving you that vaccine, and therefore usually you don't pay for that. At least in lots of Asian countries, you don't pay for that. So cost is probably a bigger factor actually than side effects, I think, for some of the vaccines we're talking about, like Japanese encephalitis and tick-borne encephalitis.
We are coming towards the end of the podcast, and I was just wondering, for someone listening who has started a vaccination course but hasn't finished, what would you say?
Well, I would say you're not protected, and if you're going to go away and you're worried about JE or rabies is universally fatal. Well, I think there's one case or two cases of people surviving, and there's 50,000 deaths a year. So your chances are as good, effectively zero. So that is really something that's worth being vaccinated against. I would say just make that extra bit of effort and go and finish your course.
Amazing. Thank you, Professor. And we have come to the end of the podcast. And I was just wondering, just before we close, is there anything that we have not discussed that you'd like to mention?
I don't think so. No, I think we've given it a good roundup, good coverage.
Amazing. Well, Professor Turtle, thank you so much for sharing your time and expertise with us.
Thank you. You're very welcome.
That was Professor Lance Turtle, PhD, FRCP, DTMH, Chair in Immunity and Infectious Diseases at the University of Liverpool. And I'd like to thank you, the audience, for listening and watching. If you've been affected by any of the issues raised wherever you live in the world, please contact our support services. Encephalitis International is here to help in whatever way we can to achieve our aim of ending death and disability from encephalitis. For all our information, please visit encephalitis.info. Thank you again, and see you next time on the Encephalitis Podcast.